Hi guys, welcome to my YouTube channel. If you're new to this channel, you're highly welcome, and to my wonderful returning subscribers, you guys are the best. So in today's video, we'll be talking about 9 things to do before getting pregnant. And please do watch till the end of this video, because the 9th one is the most important of them all. Because if you don't watch this 9th one, you can really have an another child maybe at the end of the pregnancy. So let's get into the business of today. The first one is pregnancy intention. Before you go into the journey of pregnancy, make sure you are prepared. Make sure you want the pregnancy. Make sure you are fully ready. It's going to drain you financially. It's going to drain you psychologically. Some people even go to the extent of being depressed, start putting to bed. They end up, having postpartum depression. So you must make sure you have money. You have to be financially ready. You have to be psychologically ready, because there are so many changes, physiological changes that will happen, that if you don't want it, if you are not prepared, uncle. The main point is be intentional about being pregnant. Be fully prepared for it. And the second one is access to health. Because during the journey of pregnancy, especially in the first trimester, that is the first 3 months, the changes will be much. You'll be vomiting anyhow. That in this stage now, you need to have a proximal health center. And let us say health center if you are living in a remote place, or a hospital that you have to access care from. And the most important thing, during the 10th week or the 12th week, according to the right time for registry for antenatal care clinic, according to the World Health Organization, the 12th week, you must register for antenatal, so that they're going to take care of you and your baby. Know if you have any at-risk situation or health condition that is going to compromise the pregnancy, or to know if your baby is actually growing well, to know if your baby and yourself are in good condition. So that is the essence of this access to health. So the third one is tobacco avoidance, and this tobacco is with substance abuse inclusive. In the case of smoking can actually affect your baby. It can lead to stillbirth, it can lead to premature birth, it can lead to miscarriages in some cases, and it can lead to burning of deformed baby. So that is why you really have to stop the smoking. And if you're a smoker, it's not only active smoking, even passive smoking. Maybe your husband is a smoker in a Korea. I think the passive smoker even smoke the more, because the smoker will smoke and exhale it, and you inhale all of the smoke. So in this period, if you want your child to grow well and to have no abnormality, you have to stop smoking or avoid any substance abuse. The fourth one is preconception multivitamin and folic acid use. This is very, very important. In this period, you have to commence this folic acid intake 2 or 1 month prior to when you want to get pregnant, and continuous to the end of the pregnancy. Because this folic acid intake help to avoid neural tube defects and also cardiac defects, and it will kind of encourage a normal development of the baby. And the other multivitamin will kind of make you not be anemic in pregnancy. You not have anemia in pregnancy. This one is now absence of uncontrolled depression. If you have this condition, if you are depressive, you have to kind of monitor yourself well, treat yourself well, because pregnancy is going to make your immune system low, and it will not give way to any condition that you have. Will be so obvious in pregnancy, because pregnancy is going to make your immune system low in order to accommodate the baby, so that you do not see the baby as a foreign organism and start destroying it. So, and I think in this pregnancy now is when all this disease used to find it favorable to grow. So you make sure that you treat, and control your depressive symptom, or you handle your depression. This one is healthy weight. Getting pregnant, make sure you lose your weight, because obesity can actually cause many things. So before embarking on this journey, you have to make sure you have a healthy weight, a normal weight, because obesity is even an indication for having this diabetic mellitus, which don't affect the child, cause hyperglycemic crisis for the child, which will now make the child to come out being microsomic, and also the baby will now be hypoglycemic, that if you do not arrest the thing at once, the baby might die, or might be born still, or you might have stillbirths rather. You want to lose weight, getting in a normal shape before trying to embark in this journey called pregnancy. The next one we have here is absence of sexually transmitted infection. So you must have treated whole infection, because there are some infections that can cross the placenta and affect the baby. Like we have the measles actually cross the placenta and affect your baby, and you wouldn't want your 9 months of struggle and going through physiological changes to end in optimal glycemic control in women with pre-gestational diabetes. There are some women, they don't have diabetes mellitus, but they are being predisposed to this, hyperglycemia because of the pregnancy. That's pregnancy-induced diabetes. It can also be called gestational diabetes. So in this pregnancy now, you really have to control it with diets, and if necessary, drug that is secure in pregnancy, that has more benefits than harm in pregnancy. So the last one, the pata of them all that I'm telling you now, if teratogenic medication avoidance. Avoid the use of drug, the use of unprescribed drugs, the use of over-the-counter drug during your pregnancy, especially during your first trimester, because the first week, or let us say the first trimester now, is the period of organogenesis. This is when your baby is starting to grow, and when you ingest any drug that is not good, that has adverse effects, especially thalidomide drug, although that one has been banned. So that's why most drugs are not safe, are not to be used during pregnancy, because it can actually cause defects in some. You see baby, they'll be born without arms, without limbs, or they'll have they'll be deaf and other adverse effects. So make sure you use a prescribed drug by your doctor. When the benefit of the drug surpasses the adverse effect it has, you can go ahead to take it so far as it is prescribed. Thank you for watching to the end of this video.